Funding for this edition of One-on-One with Steve Adubato has been provided by the Healthcare Foundation of New Jersey, founded by the Jewish community, and by Wells Fargo, New Jersey Manufacturers Insurance Group, auto insurance, homeowners insurance, and banking under the principle of stewardship. The law firm of Gibbons P.C., Cohn Resnick, providing accounting, tax, and advisory services for more than 90 years. And by New Jersey Natural Gas, proud to support education in our communities. Promotional support provided by the Star Ledger and NJ.com, Everything Jersey. And by the New Jersey Business and Industry Association and its monthly magazine, New Jersey Business.
This is One-on-One.
When you first heard that they were doing Charlie Rose and Gayle King, didn't you go, what?
People like laughing at others, so I don't mind if the other is me.
See, you go right into the character. That's what it is.
I'm bringing families together a half an hour each week. Man, I'm doing something special.
And so I do feel successful.
Steve Adubato here. More importantly, I'm with my colleague, Natalie Sandy. For the first time on camera, she is our senior producer. We're here for the 2013 Lester Lieberman Humanism and Healthcare Awards. A great night. We've just finished up this terrific night. We interviewed these folks who are recognized for their service, for their humanism, for their compassion. We did well over a dozen interviews with some terrific people. Your impression of these people and their service?
It was incredibly moving. I mean, I think what tied them all together is they treat each and every one of their patients as they would family members. I think that was what was the most tremendously moving experience for me, was just if one of my family members was in their care, I would feel safe with that. And they just were so compassionate, so giving, so incredible.
And it's interesting, as Natalie talks about, not just physicians, we're talking about nurses, people on the front lines, the administrative staff as well. You would think, well, that has nothing to do with healthcare, but it has everything to do with it. And some of them were reluctant to talk about themselves.
Oh, I think that's a testament to their character. I mean, they spend their whole lives thinking of others, and so when we want to grab them and recognize them for their great actions and their great works, they want to stay behind the scenes. So I think that just is a testament to what they do every day, which is completely selfless, thinking of other people. I think that's huge.
But Natalie forced them. She did, and we got them on camera. We have some wonderful interviews with some very special people. This is the 2013 Lester Lieberman Humanism and Healthcare Awards. Terrific night. Even better people. You're going to love them. Take a look. We're here with Marcia Atkin, the Lester Lieberman Humanism in Medicine Awards. Talk about the people that are being recognized tonight, Marcia, and what makes them so important.
This is very special because these are people, 32 people who have direct contact with patients, who are being nominated by their peers and by their supervisors for demonstrating extraordinary compassion and empathy and respect in the delivery of health care.
Let's talk about the awards themselves. Talk about the idea for this Humanism and Healthcare Awards, where it came from, and why it is so significant to have this night, to recognize these people in Lester's name.
Right. Well, I believe that the idea came from Lester himself. It was before my time as executive director, but I'm quite sure that it was his idea. And we say all the time that, humanism is in the DNA of the Healthcare Foundation, because we feel that way. We feel that from the very moment that we started as a foundation in 1996, this has been so important to us. And so this night is really special. As we said, there are healthcare professionals in the community. There are physicians and researchers and whatever who are recognized all the time for their professional competence. But there aren't a lot of people, hardly any, who are recognized for the quality of compassion that they bring to their job. And God, anybody who's been in the hospital or who's had a loved one in the hospital knows how important that really is.
You really need it then.
You really need it then. And research shows that patient outcomes are better when they receive compassionate care. So it works on lots of different levels.
Thank you, Marcia.
Thank you.
We're here with George Heinrich. We're talking about the Lester Lieberman Humanism in Healthcare Awards. George, let me ask you, important night, important awards, why?
Because it's about Les Lieberman and what he's done for everybody in New Jersey in the healthcare industry, recognizing the people who really make the difference in delivering care. This is so special that we are able to see people here tonight who really touch the patient and make the difference, and to recognize them because they're really the unsung heroes in healthcare delivery.
For those who do not know Lester Lieberman, he's actually sitting off to our left right now. For those who do not know Les and why this award is so important, tell folks a little bit about Les and his life's work, why it's so important.
Well, Les, aside from all the work he does in real life, he really made a difference in healthcare delivery. He ran Newark Beth Israel Hospital as board chair, and when that ownership changed, he formed a organization which took all the proceeds and put it in a foundation, and the income of that is given out every year to support humanism and healthcare in the state of New Jersey. And
The Healthcare Foundation of New Jersey.
Healthcare Foundation of New Jersey, and it is a terrific enterprise and has made the difference in so many people's lives. And they work out programs that can be endured so that they set the beginning of the program and they help them succeed so they can take them on themselves and continue to help other people. And that's what Les is, and Les is always there for everybody and really makes a difference.
And finally, the people that we'll be talking to tonight, the people that are being honored tonight, who are they and why are they so special?
They're special because they have been recognized within their institution to have done something special for the patients and those that they care for, and has made a difference in their lives. So we're recognizing the people who make the difference for the patients.
We're here with Dr. Joshua Shore, who is the medical director of Daughters of Israel, and most importantly for tonight, the 2013 Lester Lieberman Leadership Honoree. You are the big honoree tonight. There are so many people being honored tonight, but this is really, in all candor, the most significant award. How does it feel?
It feels terrific. I went into geriatrics for a very specific reason. That was to be able to speak to my patients and really get to know them. They're each repositories for tremendous history about everything from cars to countries to how they lived then and now. And it's really come true. I mean, I have to say it's been a dream that really has just come true.
Talk a little bit about your work and talk about why you believe the foundation has recognized you in this way with this award in Lester Lieberman's name.
I certainly can think of a million more deserving people, but I'm very pleased. I've known Lester through my days back at Beth Israel. I think the foundation has stood for some tremendous things in medicine and not taking our eye off the main prize, which is to connect, one person to another, whether that's a physician, a nurse, nurse's aide, the kitchen folks, whatever it is, to just treat other people like human beings and to make a friend. When you walk in that lobby, you're going to find 5 or 6 or 10 or a dozen older folks that want friendship and are going to become your friends, and it's been true every step of the way.
Dr. Shore has in fact said that when it comes to nursing homes, people have a view, a sense of nursing homes, and we often make a promise to those in our lives who are older that we'll never put them in a nursing home, right? And sometimes it's hard keeping that promise, right?
Right. I actually wrote a book, and the theme was exactly that. That was the intro to the book. Maybe you did your homework.
Yeah, I've heard that about you, and a lot of us have to deal with those issues.
Yeah. I just tell my friends, and I get a lot of calls about this, be careful what you promise. And sometimes the reality just sort of changes the situation. I think on whatever topic you address in healthcare these days, things change rapidly, and you have to keep on your toes.
Well, what advice would you give to folks about nursing homes per se, and what makes a nursing home a quality nursing home that you would want for your parent, grandparent, whomever, for yourself?
Right. There's a lot of ways now to look, word of mouth, to look on the internet. They rate different nursing homes. But I think by far and away the most important thing is to go to the home, visit it, get a gut feeling. Sit in the lobby, don't let them know who you are. Make the official visit, then make the unofficial visit. I think you can learn a lot. The main thing you want to see is how the staff addresses the residents of the home. Do they do it with a measure of respect and dignity? Do they get down and really talk so that they can hear and understand? It's not cursory, it's in depth, and they treat them as individuals. That's really what humanism and what we're talking about tonight is all about. At any level, it's individual treatment of the patient.
Congratulations and thank you, Doctor.
Thank you very much. I appreciate it. Very honored.
We're here with two very special people, humanism in healthcare, humanism in medicine. First time I ever heard that term, humanism, it came from this guy, Dr. Arnold Gold. And by the way, the young lady next to you, could you introduce her? I've never met her before.
This is the woman I live with.
Yeah.
Sandra Gold.
Sandra Gold, you are partners in the foundation that you created that is so important to this movement. And the Lester Lieberman Humanism in Healthcare Awards, talk about what makes this night so special, Dr. Gold.
This night is really an incredible night because it emphasizes the role that Lester played. Really, this would not be without Lester and the Healthcare Foundation of New Jersey and what it does specifically with humanism in medicine. They played an essential role, and this meeting, this dinner, this happening is incredible because they're recognizing the people in the trenches who really make a difference. You know, it's the nurse's aide, the nurse, the therapist, the housekeeper.
In the trenches.
In the trenches. And this then results in really relationship-centered care and the importance of humanism, caring for the patient. It's an essential part of the cure.
Sandra, let me ask you, we've talked about humanism on the air on public television for a long time, but this night is special for a lot of reasons. Your foundation and the Healthcare Foundation committed to this movement. Why?
Medicine cannot have reform without humanism. The basis of whatever happens in the future with the Accountable
Care Act
will really depend on the Congress people and the public acknowledging and understanding that it is the relationship between healthcare professionals and their patients that aids in healing, that aids in treatment adherence, that aids in fewer errors, and a lot of things that are costing us about $700 billion a year. And why this night is so important is that Healthcare Foundation of New Jersey realized so many years ago that the future of medicine doesn't lie with doctors alone, but with the team. And here they are tonight at the cusp of that becoming a national phenomenon.
Arnold Gold, Sandra Gold, I want to thank you. Again, I'll just repeat, we've been in public broadcasting for 25 years. It was Dr. Gold who introduced us to the concept of humanism in medicine. He was the one who had the direct relationship with Patch Adams, not the movie stuff. Yeah, the real Patch Adams. And what people may actually miss is that while the movie was pretty real to life, there was a real person named Patch Adams, and there was a real movement about humanism in medicine, and Dr. Gold taught us about that, and that's a big reason why we're here tonight. So thank you to the Golds. Thank you very much. The Lester Lieberman Humanism in Healthcare Awards, they recognize only the best, and that is why they recognize Clara Moss Medical Center. Introduce yourselves. You are two of the honorees tonight.
Yes, we are. I'm Barbara Corey, work in the operating room.
And?
I'm Constance Snellgrove. I'm the advanced practice nurse for the Department of Surgery.
And again, some terrific people are being recognized this evening. I've been asking folks this question. I get lots of different answers, and I'm curious. Humanism in healthcare to you means?
Just making connection with the patient, letting them know you're there for them, and just being a comforting voice when they're very worried about what's going to happen to them when they come to the hospital.
What do you think most patients, beyond excellent clinical care, are really looking for, Constance, in the healthcare system? Forget about the system. The people they interact with in the healthcare system, what are they looking for?
They're looking for people that are understanding, compassionate, caring, showing a helping hand, just a touch to let them know that we understand how they feel, what their needs are, because in today's society, healthcare seems so impersonal sometimes when you're in a major institution. So getting down to a personal level, family level, human level.
Barbara, do you think, as Constance said, do you think there is something special about the people who are recognized tonight, that they have some gift? I don't know if it's a gift or not, but some special feeling?
Well, I think you have to want to do it. There's a lot of nurses in my family. My mother was a nurse. I have aunts that were nurses, and I also wanted to be a nurse my whole life and follow in my mom's footsteps.
Tough job?
Yes, it is a tough job, but I love it, and we wouldn't be here. So,
Congratulations.
thank you very much.
We're here with Jagisha Gathardi, and she is from Morristown Medical Center. You are being recognized tonight for your humanism in healthcare. Talk to us about the work that you do.
I work with the South Asian community. I have been doing this for last 11 years. I try to save many women's lives by educating them on early detection of breast cancer, cervical cancer, and colorectal cancer, especially for breast, because many women are pretty shy. Even if they have any kind of symptoms, they would not talk about it. So we would like
Why not?
we would like to bring them out of their shell. They are afraid that they will not be able to take care of their family members. They put their families first. And because of that reason, they would say, okay, I don't have time to take care of myself. I have to continue to take care of my family, and I need to go to work. I need to take care of my kids, my elderly parents if they have them at home, and I don't have time to take care of my health right now. And we have been getting many women with late diagnosis at the cancer center,
Which is a problem.
which is a big problem. We would like to see women save their lives rather than losing their lives. So we would like to save as many lives as possible. So I do outreach and education in South Asian community to save their lives and remind them that you are the one who could take care of yourselves, not anyone else. And that's the reason why I would like to continue to do what I do.
And that's the reason why you're being recognized tonight with the Lester Lieberman Humanism in Healthcare Award. Congratulations. We're here with one of our honorees, who is Chris Bird from the Rutgers School of Nursing, right?
Yes, that's correct.
And the gentleman to your left, you in fact know who he is. He may in fact have something to do with your nomination. Who is that?
Dean Holzheimer?
Oh, you say that with reverence, right?
Yes.
Dean, let me ask you something. This young man has been recognized, is being honored tonight with the Humanism in Healthcare Award, the Lester Lieberman Humanism Award. Why?
Because of his leadership in the community, his leadership in academics in the college. He's one of the brightest, represents our future for healthcare.
Some details about Chris. He's traveled to South Africa, Peru, Haiti, Dominican Republic, and Brazil, doing missionary work. Describe that work.
Pretty much I went to most of these countries to either academically or service related, to understand the cultures, to help provide services. The last trip I just got back from Brazil, and we did a service project with adolescents on a HIV orphanage. And we pretty much did a health promotion activity to teach them about body fitness and proper nutrition, and just like worked with the kids and built relationships with them.
Why do you do that work?
Honestly, God, I would have to say, He really put it on my heart to just be out there. When I look at people like Jesus or Mother Teresa or Gandhi or Nelson Mandela, all these people were about service, and I think one of the greatest things is being out there, because I completely forget about myself and my needs, and my whole focus is on the person. And I think it's one of the most freest things, to be able to be out there and help people and just forget about my needs. But also my needs are met at the same time, ironically. So
by serving?
Yes, by serving, without a doubt.
We're here with Joyce Hyatt, who is from the Rutgers School of Nursing. She's recognized. Look at this. Why don't we pan down a little bit? This proves that, in fact, Joyce won the 2013 Lester Z. Lieberman Humanism in Healthcare Award. You do terrific work. Describe for folks exactly what you do and why you were recognized.
Okay, I'm an associate professor at Rutgers University, and I also do global health. I take students to labor and delivery as a preceptor, and as midwifery students, actually. They're nurse midwives. And I also, I have gone to Haiti after the earthquake, where I trained midwives. I actually trained traditional birth attendants to become midwives. They are lay people in the community, and they're trained to become midwives so they can give compassionate care, they can deliver babies, and they can understand why they're doing what they're doing. Instead of just catching babies, they understand why it's important to eat properly, why it's important to get prenatal care, take their iron, etc.
Why do you do this work?
Well, I love being a nurse. That was always my dream and my passion. And I also love being a midwife. I love delivering babies, and I love to see that people are satisfied and happy after you give them care. And my goal is to get the best outcome, to see that women, especially women and children, who are underprivileged, they are given care and that they have good outcomes. Especially in Haiti and in some areas where the infant mortality and the maternal mortality rate is so high. My goal, if possible, is to help to decrease this. And this is why I'm so passionate about it.
Two of our honorees with the Lester Lieberman Humanism and Healthcare Award from Seton Hall School of Nursing. Why don't you introduce yourselves?
I'm Jessica Shremchuk.
And?
Tara Elizabeth Roche.
If I were to ask you, put you on the spot, which I'm doing, talk to folks about what humanism and healthcare means to you.
I believe that it's really putting patient care as your top priority, but not only medical care, just treating them holistically as an individual.
If someone were to say, well, isn't it enough to just take care of someone in terms of their clinical needs, their medical needs, Tara, is that enough?
No, it's not enough, because the person is more than just the diagnosis. The person is a whole person, the individual, spiritually and holistically. So it's very important to take care of a person rather than just their medical diagnosis.
And talk about what this award means to you.
I'm very honored. I feel very honored and blessed to receive this award. What it means to me, it's just an amazing honor, and I'm actually speechless. I really don't know what to say, but thank you very much.
Why nursing for you?
Nursing, I feel, for me, is definitely a calling. I just feel as though I'm here to do this. So it comes effortlessly, and apparently it seems like it's what I'm here to do.
We're here with Claribel Aviles, who is the patient navigator at Zufall Health Center. Talk to us about your work. You're being recognized for your humanism, but talk specifically about your work at Zufall.
I am a patient navigator for behavioral health. I've done breast cancer and I've done HIV. Pretty much navigate patients through the system, getting their medical help, and refer them to other agencies in the community.
You do a lot more than that. In fact, she's being very modest. How about this? One of the stories that's told about Claribel is that there's a 30-year-old mother who 30-year-old mother of three who was alone in this country, primary breadwinner of a family, unable to speak English. You tell the rest of that story.
She was diagnosed with breast cancer and had no insurance, no family, no support. And I practically had to get her into not only her cancer treatment, but daycare for her kids, financial help for food and shelter, pretty much everything through the entire treatment. Now she's been cancer-free almost 3 years.
What impact does that have on you as a person?
Oh my God, tremendous impact. They actually do more for me than I do for them.
How so?
Because it's a reward. It's very rewarding to see you get to see the impact. At the end of the day, I go home and I feel good. I feel good about what I do. I love what I do, and it's very rewarding. And they're very strong. These ladies are very strong. So,
what does humanism in healthcare mean to you?
It's just caring about the individual and going that extra mile. These people mean a lot to me.
Thank you for what you do.
It's great. I love what I do.
We're here with Beth Levitan, who is the first vice chair of the Healthcare Foundation in New Jersey. Beth, we've just finished up this extraordinary night. These amazing people have been recognized with the Lester Lieberman Humanism and Healthcare Award. What does it mean to you?
Oh, it means everything. I think this foundation always has stood for humanism and medicine. And these people are heroes. They're heroes in humanism. And to be able every year to honor 30 of them, I just said to Marcia Atkin, we've honored hundreds and hundreds over the last 16 years of these wonderful people who make a difference. And that's what we're all about. And I know the trustees are thrilled, and Les is always thrilled. And it just means everything. These are the people who do the work that we fund, but they do the work. They're the soldiers.
It's very uplifting. We just had an opportunity to talk to well more than half of all the honorees tonight, and they don't really want to talk about themselves.
I know, they never do. This is really the only time that they get to be honored, and it's honored by your peers, which of course is fabulous, and I think it really means something to them. It's such a unique honor that they get from us, and it's a great celebration, and they deserve it.
They do.
So I think that's what makes me the happiest, and it always makes me the happiest.
You got a big smile on your face, Beth.
I go home every time with a big smile on my face.
Thanks, Beth.
Thank you, Steve.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by the Healthcare Foundation of New Jersey, founded by the Jewish community, and by Wells Fargo, New Jersey Manufacturers Insurance Group, the law firm of Gibbons PC, Cohn Resnick, and by New Jersey Natural Gas. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. One-on-One with Steve Adubato has been produced in partnership with St. Joseph's Healthcare System. This program has been made possible in part by New Jersey Institute of Technology.